The Gauteng Department of Health says it's seeing a significant drop in daily new admissions for COVID-19 in hospitals. According to the department, the highest number of admissions was recorded mid-July, and that daily new admissions was 320 people on July the 16th. I hate to say it, and I hate to say we told you so, but I'm going to say it nevertheless. We told you so. Whilst the department and the ministers predicted that we'd see a peak sometime in August, here on the Synthesis Sunday podcast, Dr. Anton Meyberg repeated over and over and then over again that the peak would hit us in mid-July. This is that podcast. It's August the 9th. It's Women's Day. Many schools are set to return this week, and synagogues and other places of worship are taking their first tentative steps towards opening, albeit with strict guidelines. Alcohol and cigarettes remain banned. Interprovincial travel is only allowed under specific circumstances. Social visits remain prohibited, and exercising in groups is not allowed. In many ways, the next phase is more confusing than the one before. Welcome once again to the Synthesis Sunday podcast with me, Howard Feldman. Joining me, as he has done each Sunday for the last 5 months, Dr. Anton Meyberg, specialist physician and pulmonologist, COVID expert. Good morning. Would you agree with that statement that the next phase represents and presents a number of new challenges?
Good morning. Yes, there's marked challenges ahead of us. I think what we do need at this point in time is some clarity from the government. We need Cyril Ramaphosa to speak to us and tell us where we're going, what's happening, and what we need to expect. At this point in time, we're currently sitting on 19,817,456 cases worldwide, with 729,748 deaths and 12.7 million recoveries. The United States has galloped up to 5.15 million cases with 165,000 deaths. And South Africa is sitting on 553,188 cases with 10,210 deaths. There are currently 4,749 cases in Gauteng hospitals with 605 in ICU and 324 cases that are ventilated. In keeping with numbers and gender regarding Women's Day, interestingly enough in South Africa, going against the current numbers worldwide, the predominance is higher in women. In the last few days, the numbers are 305,000 in women and about 220,000 in men. The surge has definitely come down dramatically, but we are by no means out of the woods.
All right, so the numbers are looking a lot better than they were. In private hospitals, are you seeing the same thing they're seeing in government hospitals? That is a marked decrease in people being admitted?
Definitely are. The numbers have definitely come down dramatically over the last 2 or 3 weeks. We've seen the so-called surge coming down, and we're hopefully in this plateau phase that we've been talking about.
Somebody sent a question saying that surely the fact that schools were closed, the places of worship were closed, resulted in this. Why would we be slowly opening up places of worship and schools once again? Surely we would want this to continue.
Look, I think we've got to address different issues. Schools and places of worship are very different. The schools are related to the children predominantly who are not the super spreaders, who do not get ill dramatically, where places of worship are very different to that, where it's people that are kept together in small areas, that are people that are immune compromised, that have got marked comorbidities. So I don't think we can compare the two of them. With regards to saying that numbers have come down because of these closures, who knows? Time will tell. We can't say definitively that closing the schools has caused the numbers to go down, but we do know that closing places of worship has made a major difference.
Mm-hmm. So your feelings would be, you're supporting obviously the schools opening again because you sit involved in a number of these boards. Your feeling around places of worship opening up?
I think we still got to be very careful. We still know that there are people with comorbidities, people with illnesses, and it's a very, very slippery slope. So once you start thinking people go back to places of worship, what's next? Do they go to communal gatherings afterwards? Do people think they can start socializing now and start going over? It's got to be done very strictly with strict guidelines and strict monitoring in order that we don't falter and let ourselves get out of kilt.
All right. So also a lot of questions around people going on holiday. I know that this is a long weekend, Monday, tomorrow being a public holiday. People have gone away. Some of them within the borders of the province. Some have managed to find ways to seek permission to go across border, in other words, into other provinces. But what does that mean now when they return to the place that they've lived?
Look, without being judgmental, because I mean, you can be very easily judgmental and judge people. We're all in lockdown fatigue. We're all tired. Every single one of us wants to go away. But there's still a law, and the law says you cannot do inter-provincial travel. That is the law, unless there's extenuating circumstances like health reasons, funerals, educational needs, that type of thing. So one shouldn't be doing inter-provincial traveling just for leisure at this point in time. However, people are doing it, and if they are doing it, you need to be safe. You need to stay within the same protocols that you've been practicing whilst you've been in your hometown where you've been. Do not intermingle with people. Do not socialize with people. Stay in your cars if you're going to the Kruger. We know plenty of people that are going away. Just protect yourselves so that you can protect each other and protect us. We need to protect each other because at this current time, we know the numbers are coming down. We don't want the numbers to surge because people now are losing that responsibility and people aren't being careful. So if you have gone away, enjoy yourself, but be careful. Take care and look after each other so we can all be protected.
Right. And if you have come across a lot of different people whilst you're away, then when you come back, just be responsible. Don't
quarantine yourself if you've been amongst a lot of people, because you've got to protect everybody else. And ideally, it would be nice to say a blanket statement. Anyone who's been interprovincial should be quarantined for 14 days when they get back. I'd love to say that, and I'd love for people to do that. And that would be the ideal world. But unfortunately, we can't enforce that.
It seems to be, and your opening statement was around this point as well, is that we actually are desperate for better guidelines at the moment, because in the absence of guidelines, people need to make their own decisions, and sometimes we make those decisions without being fully knowledgeable.
That's 100% correct. And especially now on Women's Day, one would expect the president to come out with a statement, whether it be against gender-based violence or about the more pressing issue that we're sorting out now, the COVID virus. What are we supposed to do? Are we still in a level 3 lockdown? Can we have other requirements that can be allowed to do, and we're allowed to fulfill? We need the guidance. We're people that have been locked down. We've been imprisoned per se, and we need guidance.
Mm-hmm. What's so interesting is the stats around Women's Day that you mentioned earlier, that in South Africa it seems to be significantly more women being impacted, and yet we hear about the men much more. Right. Is it because men complain more?
I think so. Man flu is a big killer. We know man flu is a big thing. Look, there's lots of studies that also show that people with high testosterone, bolder people, do get coronavirus more often. We've seen that. We've heard that. Whether it's true or not, who knows?
I think I had it in 1996.
Yes, but you're the hypochondriac. When you got it in 1996, we didn't even know it was COVID-19 then. It was more likely COVID-96, but it's a whole different ball.
It's when I started losing my hair, so it could be, Mm-hmm. Anyway, okay, so let's get on to some of the questions that people are asking. I want to go over the whole preventative regime again, because we often just skim over it. We talk about what people should take. Candy's asking about either ivermectin as a preventative drug.
So that's very important. Ivermectin is not a preventative drug. Ivermectin is a drug that treats parasites. It's used mainly by vets to treat the parasites in dogs, cats, all different types of animals. But it also does treat things like scabies, lice, river blindness, filariasis. It's a very good drug, and it's actually been incorporated in the guidelines in Peru. The problem with this drug is a major study was done in April. And this was the same group of people that did the study on hydroxychloroquine that published in the Lancet. So we can't really take this study too seriously because there are a lot of variables in the studies. It has been looked at. People are looking at to see if it does help. But where we're standing now, there's no reason to use it in our patients as a treatment for or prevention of the virus.
Okay, so let's just go through them in terms of prevention. Vitamin C is something that we all should be taking. How much vitamin C should we take a day, assuming that we are normal, healthy, functioning?
Okay. So I think let's do a broad sort of collection of all the vitamins. Vitamin C, 500 milligrams a day. Zinc, anything from 50 milligrams to 100 milligrams a day. Thiamine, 100 milligrams a day. Vitamin D, 3,000 to 4,000 international units a day.
Slow down. How much thiamine? I'm writing this down.
100 milligrams a day. And then vitamin D, 3,000 to 4,000 international units a day, or 50,000 units of calciferol, which is a high strength, once a week. Those are the best preventative vitamins to use at this point in time. They're good to use. And as I say, as I've always said, if you don't benefit from them, all you're going to do is pee them out.
And you're going to help the economy. So that's always very, very nice.
Exactly.
The zinc often that I've seen is associated with vitamin B, vitamin B12. Is that okay in that form? Or it's should fine. You take
as long as you're getting the right combination? It doesn't matter if it's mixed with other vitamins.
Okay, and those are the things we should be taking every single day. Children as well.
Children as well, they can get a good multivitamin. They don't have to have the same doses. Children need lower doses of the vitamins, but a good multivitamin for children is equivalent. Once again, as I said, the best one is Centrum A to zinc, if you can get it, but there are large amounts of children's vitamins that one can take that have got a full spectrum of all the vitamins that are required.
Let's just talk about, for a moment, about exercising when you aren't 100% or you might be worried. I saw a statement somebody made on the internet that deep breathing, yoga, please just walk me through this.
So I think exercise is very important at the best of times. Whether you've got a pandemic or you don't have a pandemic, we know that exercise in moderation is very important to help with our health status and help look after ourselves. There are lots of myths going around the internet that if you do yoga and deep breathing, you'll help prevent the virus. The point of the matter is that it's a respiratory virus, droplet spread. If it goes into your lungs, it's going to spread into your lungs. It doesn't matter if you deep breathe, if you breathe on your nose, if you breathe upside down, you're still going to spread the virus into your lungs. So unfortunately, yoga will not help prevent the virus. Is yoga a good thing to do? Definitely. No doubt about that.
And there's a holding your breath test to see if you've how strong your lungs are or something?
So there's a myth about holding your breath that says that you can tell that if you can't hold your breath for a certain amount of time, you'll be able to diagnose yourself with COVID-19, which is an absolute fallacy. The only way to diagnose COVID-19 is through the swab and through saliva tests. You can use correlative tests like CAT scans and blood tests to make you more aware that you probably do have it, but the only definitive test is the swabs.
All right. And does it make a difference if it's a throat or nose swab?
So the nose swab, the nasopharyngeal swab, where they stick the swab right to the back of your brain and you get a headache for 3 years afterwards and you think like you've been drilling in China, that is, excuse the pun, that is probably the best one to do. It's a high sensitivity. It's a better yield. You can get better answers from that. The throat swab is not as effective. The problem is they don't have the correct swabs for the nasopharyngeal swabs, so they're tending to do more throat swabs than nasopharyngeal swabs.
And are we still seeing a number of false negatives? One of our viewers spoke about the fact that she had all the symptoms, including the loss of taste and smell, went for, I think, a test or maybe even 2 tests. Both were negative. And then when she was about to go for a procedure, she had to have a COVID test just as a matter of course and protocol. She's fully recovered, doesn't have any other symptoms. And now suddenly the test came back positive.
Once again, it's about how the test is done, okay? But if you've got all the symptoms, if you've got a loss of taste and loss of smell, and you've got the fever and you've got the cough, and the test comes back negative, speak to your doctor. Your doctor will tell you to quarantine for 14 days because you have got the virus and it's unlikely that the test was correct. The fact that it was picked up a week or 2 later, even though she was negative initially, means that it's probably done better, that the swab was picked up on a better yield, and they were able to find out that she was positive in what she thought clinically, but wasn't proven with the swab. Okay.
Just to take us through again, the current treatment that you are using, has that changed at all?
Yes, so as of Friday, remdesivir became available in our hospitals, which is the new drug. Once again, it's not curative. It doesn't cure the disease. It does decrease your morbidity, and they say decrease hospital stay from about 15 days to 11 days. So that's one of the new things. We're still using Decadron, dexamethazones, or other alternatives of corticosteroids, which we've been using from the beginning. We're still using all the other modalities of treatment, including different types of ventilation, different types of proning. We're still trying our utmost best to prevent ventilating patients. In other words, we're still trying to prevent putting people on life support, where you put the endotracheal tube down their throats. We're trying with other modes, such as high-flow oxygen, non-invasive ventilation, we're finding that we've got a high yield of getting people out of hospital if we don't have to put them on full ventilation. What's new at the moment is a trial is being done with interferon beta, which is used for multiple sclerosis. It's called REBIF. This is a protein which is used to treat different pathogens, especially viruses. They're looking at a trial combining that with remdesivir to try and treat COVID-19 patients. So that's new on the horizon.
How do you consider our success here in South Africa in terms of our mortality rate?
Well, if you look at the mortality rate of 10,000, it's extremely low. And I think that goes back down to our early lockdown, our early thing at the beginning when the government were on the ball, when we were playing the game right, when things were done properly, when lockdown was effective, when we had the time because of what we'd seen in other countries to get our hospitals on the right track, to get our units ready and to get everything ready and in place so that we could attack this virus.
What's interesting to me is when I follow the discussions that you're having and the things that you're involved in, something I've noticed is that there's a very thin line and a very fine line between politics and medicine and behavior, and in terms of schools and places of worship, etc. Do you find that this, more than any other illness that you've encountered, requires you to maybe look outside of your speciality and your field, which is medicine, and look at all sorts of other
I do find that. I've found I've become a bit of a politician in the last few weeks, trying to make decisions that I shouldn't be making. My role and my expertise are in medicine. I'm a scientist, I'm a doctor, I'm not a politician. I can't make those political decisions. I've got to put the evidence that I know and I've taken from all the academics and put it together and use it in an academic, medical, scientific way in order to help people. And I can't propagate any other protocols from a political point of view.
And economic as well. You're not an economist.
I'm not an economist in motion. I can't make those decisions. I can just give the medical side.
Which is very interesting, because until now, I would think that in South Africa, we've managed to keep those lines fairly clear. What we've seen in America around Donald Trump, the Republicans and Democrats talk of the fact that they're trying to get the vaccine out before the elections on the Donald Trump side. But of course, on the Democrat side, the claim is that they want the deaths or the incidents to continue until the election because scared people want change.
So it's all politics. Yeah.
It's all politics. That must make practicing medicine a lot more challenging.
Difficult, very difficult, 100%.
Okay, very interesting indeed. On that note, and I'm going to ask you a question that you might not want to answer, but one of our viewers say, is it ethical to report someone who has not disclosed to people that they have either been around somebody positive or are positive? How are we as a society meant to behave around it? Do we have a moral duty? Do we have a medical, ethical?
So it's actually not a tough question. I mean, I think we've said from the beginning, you can't be selfish. This is not a disease of being selfish. It's not a disease of walking around without a mask and not protecting people, not protecting yourself. We have an ethical duty to let people know if you're positive, if you have the virus, you have an ethical duty so people can contact trace, so people can be aware that they've been exposed to you if you were wearing a mask, if you weren't wearing a mask, so that they can protect themselves and they can protect others. So yes, I do believe we've got an ethical duty to report these things.
Okay. And I mean, I don't even know what the answer is, but who do we report to?
So, I mean, you can report to your community leaders, or you can report to people who you deal with, or put it on one of your forums that you spread it with. But people need to know. And it's not about naming and shaming. It's about protection. It's about looking after each other. People shouldn't be stereotyped by the fact that they've got COVID-19. They should tell people they've got it so they can isolate, so people can protect themselves. We have to protect ourselves. It's not about judging anybody. It's about protection.
How are we doing in terms of a vaccine, Clive? And a lot of people wanting to know. Seems to be a lot going on in Israel, in Russia, in the UK, in the US. But does this all come together?
It does all come together. And a lot of the trials are in phase 3 trials where they're testing the vaccines on humans. We're not sure when they'll be ready. Russia claims that they'll be doing massive spreading of the vaccine throughout the whole of October. We're still waiting to see, as you said, with the political sphere in America will be if a vaccine will come out just before Trump stands for re-election again. We don't know, but I mean, the ball is rolling and it's going very fast. People are pushing and they want a virus soon. And people can ask a question is why the vaccine hasn't come out if we've got something like a flu vaccine. And with regards to the flu vaccine, we use the same vaccine strategy every single year, which we've been using for the last few decades. And it's about swapping the antigen, the protein that we know about, and basically how to swap this with the latest strands. We don't know the strands of the coronavirus antigens yet. We're working on that. But I believe as soon as they do know it, they'll be able to swap this on a yearly basis.
All right. Taking a look at some of the questions. We've already answered this one. Jacques wants to know, is it not too soon for places to open? Linda says, if you're 2 meters away from someone having a fairly long conversation, but you're both wearing masks, not N95s, ordinary, N95s.
N95s, yeah.
Yeah, sorry. Do you fear, and both are either indoors or outdoors with the assumption that neither suspect that they have COVID-19, but you never know. Are you reasonably safe?
Can't answer that question because people's behavior are different. So someone can be standing with their mask and they can pull it down while they're standing there. People don't realize what their habits are and what they do. Mm-hmm. So you could be speaking to them. They could sneeze, they could cough, they could pull their mask down. You lose focus. It's still dangerous. Despite the fact that you're wearing a mask and you are social distancing, doesn't give you complete immunity. Yes, it's much better. We know that it's definitely more protective, but there's nothing that's infallible about it.
Ilana, a listener a reviewer in Melbourne, Australia, says, here we are at stage 4 lockdown, not allowed to go anywhere except essential food, shopping, doctors, chemists, walking or exercise. They've also got a curfew. This is going on until September, but the thoughts are that this is going to go on until December or January 2021. So what's so interesting to me is one almost gets the impression that every city is going to go through it. And if they haven't, then they're still going to.
Every city except for New Zealand, which New Zealand has had 100 days of no cases.
Because no one wants to go there.
Point taken.
I just think that's So lots of questions around that. How do we open up? What do we do in terms of people going back to work? Certainly, we're starting to see that people are getting more and more restless at home. Is there a way to release a bit of that pressure or that fatigue around staying at home, but still being responsible? I know somebody who's set up in their garden outside big barriers, and if a kid has to come over, that they can play on other sides of the garden. The problem with all of these things is, as you mentioned, the slippery slope. Where do we go from there?
100%. And we still got to remember that we still got taxis traveling all around the country with more than 20 people in a taxi sitting next to each other. There's still a high viral load outside there, despite the fact that the numbers are coming down. And that could also be the fact that they're not testing as much. But remember, they're not testing as much because we're being more specific with a lot of the testing that we're doing. So we're not sending every single person for a test. You've got to be sent by a doctor's note, and it's got to be something that really needs to be done, not just because you think you might have the test. So yes, there are a lot less tests being done. But we've got to be very careful. The virus is still extremely high from its spread point of view. It is still out there. It is still virulent. So we can't drop the ball here. We can't say that, well, the surge is coming down, we've plateaued, we can now drop all the requirements for the lockdown and we can go start socializing. That's not the answer, because then we're going to get what we call, or people are calling, this so-called second wave, and we're going to have a massive surge again, and we're going to go back 1,000 steps. So we can't do that.
Manessa says, if people have recovered fully from COVID, can we now spend time with them? Well, your answer last week was no, absolutely not, because we don't know how long immunity lasts.
Well, first of all, we don't know how long immunity lasts, and we don't know how severely somebody had the virus. Were they asymptomatic? Were they mild? Were they severe? Are they making antibodies? And can they themselves get reviral sort of spread. We don't know these things. It's too new. So the answer is no, you cannot and should not.
Right. And how are we doing? How are we doing on the antibody testing here in South Africa?
So the antibody testing is widely available in trials where they're doing with convalescent plasma. They're testing people who they think might be able to give convalescent plasma to people. And once again, I don't believe you should hang up everything according to the antibody tests, because the antibody tests are not 100% sensitive or specific. And if you've had a previous type of coronavirus, it could pick up that coronavirus. And once again, we don't know how long the immunity lasts for. So you could have a 3-week immunity period. You could have a 3-month immunity period. There's multiple cases all over the world of people being reinfected with COVID-19, and we just don't know enough about it now. And once again, I'm going to go back to my famous immunity passport. We don't know what people's immunity is, so we can't give them a passport with an antibody test.
Darren wants to know, does Dr. Meyberg believe that the numbers that the health department are disclosing daily are accurate? With all the fraud and corruption, how can we believe anything that is being published? It's a fair question.
It is a fair question, but what you've got to understand is they take numbers from all the hospitals, they take numbers from all the communities, all the laboratories. These are all sent in and tabulated together. The National Institute of Communicable Disease runs this as well. There's a whole host of people that hopefully that are not fraudulent, that are doing this type of surveillance and checking it out. So I do believe that the numbers we're getting are reasonable and are on target.
And a few people asking, I've been extremely cautious with COVID since March. When would we say it's safe for our kids to see cousins and for me to see my siblings?
I believe that would be correct when we're out of the plateau, when the numbers have dropped dramatically, when our R0, this number of transmission, is less than 1. The current R0 is 2.5. In other words, people can transmit, one person can affect 2.5 people. When they can affect 1 or less people, then I think it will be safe to do that.
All right. And a few people asking, and we referred to it a little bit earlier about going away. If we are going to go away, are there measures? What should one be doing? Where should one look for in terms of what should one look for in terms of accommodation? Forget the whole interprovincial thing, because that's not illegal. That is not legally possible. Let's just talk about, let's say,
so if you're going away in Gauteng, okay, let's say you're going away in Gauteng. Try to find out when the last time the place was used. So you can't go to a hotel. The hotels are taboo. But if you go to a chalet, let's say in Joburg or in Gauteng somewhere, make sure that no one's been in there for 48 hours before you go there. Don't allow staff to clean it whilst you're there. Don't allow people into the chalet whilst you're there. Don't associate with other people. Stick to yourselves. Stay in your cars. If you do have to go into a shop, wear your masks, wear gloves, wear visors, whatever you think you need to do to protect yourself, but protect yourself. Keep on doing the sterilizing with this hand sprays, keep on using antibacterial swabs, and just keep on protecting yourself and staying alone and staying as a family unit. Don't go together with your other families and think that it's okay, because it's not.
This is a heartbreaking one from Renee. She says, if I want to hold my baby grandson, how long would I have to go into quarantine before first? Would I have to have a test beforehand?
Look, it's a very, very difficult thing, because as we know that even if you are tested, you get false negatives. And how old is your baby grandson? What is the immunity of a neonatal child or a young child? And what are your comorbidities? And remember that even if you are tested as a grandparent, the child's parents still can spread the bacteria or the virus or anything to you. So there's so many different types of ways it can be spread that it's still not safe. I mean, you can obviously say that you can go into full PPE where you wear a complete biohazard hazmat mask and the whole thing, and maybe then it's safe, but then you're removed about 15 times anyway, so what's the point?
Very, very difficult. There's lots of questions from grandparents saying, when can we be with our children, our grandchildren? It's a very, very difficult and very painful.
It's terrible. As I said, it's my own also personal pain. I don't get to see my parents. My children don't get to see their grandparents from either side. It's very hard, but that's the way we are protecting them. That's the way we're keeping them safe. That's the way we're keeping them COVID-19 free. And that's why we make sure that, please God, soon we will see them without any issues.
Mm. How long do you think this will go on for? When do you think, we're obviously starting to see the first steps being taken towards getting back to some form of normality.
Yeah, well,
I know,
with all these people going away and everyone going to different provinces, watch those provinces now, because who knows what's going to happen in those provinces. But you got to just watch what the plateau is doing. If the plateau goes down dramatically within the next month, then maybe in a month or two, we could be seeing a different phase. And hopefully by then we could be getting back into it. It's too early to tell. I'm not a prophet. We can't prophesize these things, but we just got to wait and see what the trends are doing.
Absolutely right. There is good news though, isn't there?
There's good news. So as I've said initially, first of all, remdesivir is here. It's available. We can use it now in our hospitalized patients. It's an intravenous drug. It does decrease your morbidity from 15 to 11 days, and it's available. The second good news, the Gauteng Health Department has said there's been a massive decrease in the number of cases, and we're seeing in the hospitals there's a massive decrease. And the third part of the good news is that, especially for me and other parents, some of the private schools are going back. And it's done in a fashion that's being done very well controlled and very well moderated with good protocols. And that's good not only for parents, but it's excellent for children. It's great news. They need to go back to school. They need to get rid of their anxiety. They need to be with their friends, and they need to be in those type of environments. I think without judging people, we need to just know that we need to embrace this virus. We need to know what it is, what it's about. We need to look after ourselves. We need to look after each other. And I think, as Dr. Seuss quotes, unless someone like you cares a whole awful lot, nothing is going to get better. It's not.
Absolutely love that. Did he really say that?
He really did.
Wow, that is quite unbelievable. A prophet in, well, not our time, but the time before. I'm Howard Feldman. This is your Synthesis Sunday podcast with Dr. Anton Meyberg. We speak to you each Sunday at this time. Take care of yourselves, take care of each other, and let's get through this together. Have a great one.